Hi, my name is Heidi and I'm a pharmacist, and today we're going to be talking about the KwikPen. When you receive your KwikPens, you'll see there's several parts. There's a cap, and this covers the vial that has the insulin in it, and it also covers an area on which you're going to put a pen needle to inject your dose. Then on the other side here you can see there's a window and there are numbers, and those numbers represent how many units of insulin you're intending to inject. There's a dial, and this dial moves the numbers through the window, and you can dial up the amount of insulin you intend to inject, and then there's a plunger on the end, and once you figure out how many units you're going to inject, you press down on the plunger and this will inject your dose. So when you're ready to use your insulin, first examine the insulin and make sure it looks normal to you. So sometimes insulin is clear, at which point you're ready to go. You don't need to mix it or anything. If you have cloudy insulin, such as a 70-30 insulin, inspect it. If it's not quite completely continuous in appearance, then you're going to mix it between your hands like this. And you're just going to mix it until the insulin looks uniform in color and appearance. That's usually about 10 to 15 seconds. So when you're ready to inject, first grab your pen needle, attach the pen needle to the top of the pen by carefully pressing down on the top first and then screwing it on. And once you feel a little bit of resistance, that means that the needle is all the way on. You can pull off the outer cap, which you're going to save for later, and then remove the inner cap, which you can throw away. And then under the inner cap you can see the needle. Before injecting your dose, it's important that you prime the needle every time. This is to make sure both that you're getting your correct dose and also to make sure that your pen is working correctly. So to prime, you're going to dial up the dose of 2 units. So you're just going to twist the pen until it says 2 in the window with the arrow pointing to 2. And then on the table in front of you or above the trash or however you'd like to do it, you're just going to push the insulin out. So you press on the end here, and you should hopefully see at least a drop of insulin on the end. If you don't see that, it might be that you have a new pen and there's just a little bit of a bubble in the top. You can prime again, so you can pull it up to 2 units again, and then press down. And you can do this 2 to 3 times, especially if it's a new insulin pen, until you see the insulin. If you've done this multiple times and you're not seeing any insulin come out, talk to your pharmacist. Your pen might not be working correctly. So this pen is working fine, so we're now ready to inject our insulin dose. So at this point I'm going to dial it up to 10 units, which is my insulin dose. So I dial until I see a 10 in the window with the arrow pointing to 10. And then I'm going to inject either into the abdomen or the thigh or the arm, the back of the arm, by going in at a 90-degree angle, sticking the needle in until it's flush, pressing down on the end, so don't twist the end at this point, press down, and then hold it in for about 10 seconds. To make sure you get your dose, and then carefully pull straight out. So then you are done injecting your dose. There is one last step to make sure that you dispose of your sharps correctly. So the needle needs to go back into the outer cap. I'm going to do that by scooping the needle back into the cap, and then once the needle's all the way in, you can screw the needle off safely so that you don't stab yourself. The needle then goes in a sharps container, and once the sharps container is full, then contact your garbage disposal company to ask how they prefer that you dispose of your sharps container. And then you can also just recap your KwikPen. If you have more questions about the KwikPen, please contact your pharmacist or doctor. Thank you.